COVID-19 has demanded so much of our frontline workers. They tend to the very sick. And in this pandemic, when families can't be there because of quarantine issues, they stand in sometimes, even helping them say goodbye. And that's just a partial snapshot. It's why, as anchor KRISTYN Hartman learned, one local healthcare system has a program to help. KRISTYN.
Yeah, Tanya, the Bon Secours Mercy Health medical system wants employees to take time to take care of themselves. So it started something called The Pause, a daily double dose of a mix of things it hopes can help not just frontliners, but all members of the work family.
It is good that we are all together, and so let us pray.
This has been a tough time for healthcare workers, so tough. Headlines in a range of articles talk about mental anguish, stress, a potential epidemic of PTSD. None of it's lost on local folks within Bon Secours Mercy Health.
Yeah, it's absolutely taken a toll. This was a sprint, but now it's turned into a marathon. And we're all human at the end of the day, and we are asked to deliver care constantly.
Do you guys as a medical system have a responsibility to take care of the people who are working through this?
I would say it's a partnership. We identified that people needed about a 5 or 6 minute ability to just step away from their routine, take a deep breath, center themselves.
So they're providing a much promoted breather.
Welcome to The Pause. It's great to have you with us this morning.
With the hope employees find the twice daily conversation on their internal Be Well site. Moderator Herb Schum brings in guests who've walked the path.
Really being human and taking that time that we need so that we can properly take care of people.
People who can offer self-care strategies to frontliners in this stressful coronavirus time. More broadly, Pause is also available to system employees working from home and looking for ways to fight isolation and connect, even if they're not in the same building.
What we're finding is that peer support goes a long ways.
I think that we have to develop this concept of emotional PPE.
Because people crave it. We're told some 2,500 employees have clicked into Pause, including Jennifer Stefanak in Youngstown.
They're using the content.
She's found the Pause programming helpful and shareable.
I've taken the content from other leaders that I've listened to, and I've used their content in in-person sessions. Most departments have a huddle every day. And we've heard that managers are using that, and so right in the huddle.
Taking that break to reflect, to breathe, to share.
We have to do this to stay healthy.
It is really all about mindfulness, and it is something anybody can do. If you're challenged by COVID-19 stresses, the Bon Secours Mercy Health people I just spoke with say you can intentionally stop down, take a breath, breathe, and reflect on your own. Whatever it is, it's important to take time to center yourself in these tough times, Tanya.
Incredibly good advice. Thank you, KRISTYN.